Welcome to the first segment of our Health Equity Basics Learning Series. This program is brought to you by our regional chronic disease collaborative partners in Alaska, Hawaii, Montana, and Wyoming. These are all the segments included in the series. You can watch all the segments in order for a full overview of health equity basics or access individual segments to focus on your immediate needs. This learning series is meant to provide foundational knowledge on the broad and deep topic of health equity. We will present common definitions for terms associated with health equity, review what social determinants of health are and how they affect health equity, and leave you with some action items so you can start addressing health equity for yourself, your patients and clients, and your community. Health equity is when each person has the chance to reach their full health potential without facing obstacles from social position or other socially determined circumstances. Advancing health equity means working to reduce and eliminate health disparities that are a result of systemic, avoidable, and unjust policies and practices. It's important to address health equity because not all people have the same advantages or starting points in life. Advancing health equity improves all areas of our life and goes beyond the individual. It extends to our children, our community, and our society. Advances in health equity not only have a positive effect on groups facing disparities, but also on the quality of care and health for the broader population. Health disparities are the differences in health status among distinct groups of the population. Based on information from the Centers for Disease Control and Prevention, women in the U.S. tend to live longer than men. This is an example of a health disparity. These disparities can be caused by many different factors. Health inequities are the health disparities resulting from systemic, avoidable, and unjust social and economic policies and practices. Health inequities are responsible for many of the health disparities that can affect historically marginalized people or disadvantaged communities. Achieving health equity means every person attains their highest level of health and culturally and linguistically appropriate services. Focus on appreciating each person's uniqueness. Class can lead to increasing health equity because they promote respect and acceptance. Advancing health equity requires work at all levels. We each have a role. We will cover actions each of these levels can take later in this learning series. The next segment covers some common terms and definitions related to health equity. Thank you for joining us.